Good afternoon, everyone. Welcome back. Today is Thursday, April 30th, 2020. I'm Andrew Rand, Chairman of the City County Health Department here in Peoria, Illinois, and I'm today's MC for our daily press conference on behalf of Mayor Artis of the City of Peoria, Chairman Krug of Woodford County, and Chairman Zimmerman of Tazewell County. I wanted to just briefly cover a topic this morning that I was asked about by a few cohorts and neighbors actually in the last week, and that had to do with the safety of our skilled nursing facilities here in Central Illinois. Director Hendrickson, Monica, to all of us here, has been very, very fact-based in her assessment of the safety of the skilled care facilities in our community. And frankly, since they began the sheltering orders and started restricting access to those facilities before the rest of us were ordered to shelter in place, it's remarkable how much of the epidemic they have been able to avoid, especially considering the fact that they've got team members coming and going. Their caregivers don't necessarily live there as well. And as I was asked these questions, I was sort of being put on the spot to explain whether these outbreaks were specialized or some kind of traumatic issue in our community, and except for the fact that they may produce loss of life, which is significant, and people are getting sick in some cases. We are very lucky so far to have been able to contain and control that spread because of the policies that have been implemented before the shelter at home.
Pointed a really important fact is that it is very much, we can go onto the Illinois Department of Public Health website and we can look at the statistics and recognize the fact that those numbers are really high. Those not only reflect confirmed cases, but even suspect cases, because early in this response, long-term care facilities were tasked with taking care and isolating and providing health for the most vulnerable population. And so those numbers reflect a lot more because we wanted to be very aggressive in understanding the spread of the virus. So compared to the general public and other entities, they are held at a higher standard where even suspect cases are being reported as confirmed on their website. And that's part of the reporting system that the health departments throughout the state use. Having said that, I think it is really important to recognize that the women and men that work at these facilities continuously provide great prevention services, work diligently, and have the best interests of their residents in mind. And so we are very saddened about this loss, recognizing the fact that it is in a long-term care facility, but also recognizing the fact that our long-term care facilities have been working diligently to address this. In regards to the hospital data, currently in Peoria County, ICU beds in use are at 21. That includes 5 for persons under investigation and 16 for confirmed COVID cases. Non-ICU beds in use is 26, and again reporting 1 new death in the past 24 hours. For Peoria County specifically, of the 89 cases, 42 are recovered, which accounts for 47% of our cases. 33 are at home isolation, which is 37% of our cases, and 11 are hospitalized, which is 12% of our cases. Next week, we'll start trying to report for the Tri-County totals in terms of recovered, home, and hospitalized. I will just request that the data might not change as frequently depending on what county is reporting. So some report on a daily basis, others might be reporting every 2 to 3 days. So just bear that in mind. In terms of, again, Peoria County, of our 89 cases, 60% are female, 40% are male. And again, our highest age range is at 30 to 39, followed by 50 to 59 and 60 to 69. 56% of our cases are white and 39% of our cases are black. Today, Heartland Health Service at 3 p.m. reported 110 individuals tested at East Bluff and 79 individuals tested at the Carver Center for 189 tests just in 2 sites today. Peoria County's data, again, 23% of our cases were identified through Heartland Health Services, just focusing on the fact that with increased testing, our ability to identify cases as well as have access to cases increases every day. So with that, I'd like to introduce our next speaker, who is Kate Green, Executive Director for Home for All, which is the Continuum of Care, to talk about the alternative housing plan that has gone into effect. The first resident or patient of our plan took, residency on the 24th, and wants to give kind of an understanding of how the process works and some feedback, and even answer some questions about people having the community about this alternate care.
Thank you, Monica, and good afternoon. Again, my name is Kate Green, and I'm here representing Home for All Continuum of Care, as well as the housing branch, which was really put into effect to try and address kind of this alternative housing need that we knew we had. So I'm going to do just a quick recap of the populations that the program will serve. We talked about this a little bit a couple weeks ago, as well as go into a couple updates that we have regarding the program. So just to get started again, a reminder about the populations who are qualified for this program. That includes 3 separate populations. The first is those who test positive, who do not require hospitalization but do need isolation. And so that includes individuals who are discharged from the hospitals. The second is those who have been directly exposed to COVID-19 but do not require hospitalization but do need an effective means to isolate. And the third is asymptomatic individuals, and that would include high-risk individuals who need social distancing as a precautionary measure. So individuals who are over a certain age, 65 years old, with underlying health conditions. And we're primarily looking at congregate living facilities in terms of shelters or unsheltered homeless population when we're considering that particular group. But it's very important to note that that's kind of the first stage of qualification. The second stage then is evaluation by a healthcare professional. That could be a primary healthcare physician, a hospital discharge planner, or Heartland Health Services to really validate kind of the additional vulnerability criteria for an individual to then be entered into the hospital or into the hotel. And I should clarify, too, that that referral component is pivotal. It's really key. If you don't have that referral, it's not a walk-in program at the hotel. The hotel is informed in advance of the individuals who will be participating, who are coming into the program. They're even taking such measures as advance assigning rooms, pre-populating room keys to try and minimize that face-to-face interaction that they're having with individuals at the hotel. So just a quick reminder that that referral is really necessary in order to be entered into the program. In terms of those who are potentially experiencing homelessness or some of those other considerations that have heard about the program and are interested in resources, I did want to reiterate today that all of our homeless service providers are still online, fully operational. I'm very proud to report that because in some communities across the state that isn't necessarily the case. So if you know somebody who is at risk or is currently experiencing homelessness, or you yourself are in that pool, I would encourage you to call our information and referral line at 211 or at 309-999-4029 to get connected with some of those resources. And again, those resources can include homeless prevention, emergency shelter information, as well as assessment into our prioritization process for permanent housing. So keeping those phone numbers in the back of your mind. In terms of going back to the alternative housing program, as Monica mentioned, we did accept the first individual onto the program on April 24th. So we've been up and running now since then. We currently have 6 individuals who are enrolled in the program. All 6 of these individuals are non-COVID positive and are experiencing sheltered or unsheltered homelessness, and that's how they were referred into the program. But they also, of course, met that additional vulnerability criteria and received that additional evaluation from Heartland Health Services. So the program has not yet received any referrals or placements from hospitals in terms of hospital discharges. And I did want to mention quickly that the program does include support from Heartland Health Services to provide on-site monitoring. There's access to television, Wi-Fi, local calls, and we're also providing meals and laundry service. And I think some individuals maybe have heard about those services and it seemed like it's a very nice experience for individuals. But I just wanted to reiterate that these are really kind of the requisites to being able to isolate within a hotel room 24 hours a day. So we're really just providing those essential services that are needed for individuals to remain isolated at the hotel while they're there. And that's all I have. Thanks.
Thank you, Kate. I'll begin with questions for Kate Green.
Hey, just for those who are listening, could you just remind them how many rooms are available at the hotel?
Absolutely. So there's an agreement in place with 4 Points for up to 150 rooms. So there is capacity for us to expand quite a bit. However, I think the goal for everybody involved is to not see those numbers go up, and especially considering that that's including not only rooms for individuals experiencing homelessness, but also for a potential surge within our hospital settings.
Has there been any thought to loosening the criteria since there is still so many rooms available?
I think the idea is that we want to maintain access to those rooms if needed. We don't want to expand and then run into an issue where we don't have capacity when it does become an issue. So in terms of making sure that we fulfill the need of individuals in the homeless population, we are looking at, especially at our funding sources, because we do have a grant, so making sure that we maximize that. But outside of that, I don't think that we want to loosen the criteria explicitly just to meet the 150 room requirement.
Resident came in on the 24th. How long do you get to stay there? I mean, because if you're somebody who's at higher risk, you're still going to be at higher risk, 2 weeks from now, and this virus is not going anywhere anytime soon. Is it an indefinite stay, or is there a limit on it?
That's a great question, and especially, again, referring back to those individuals experiencing homelessness. Our team, in terms of Continuum partners, are working on permanent housing placements as best we can with those individuals. So our goal is not to return them to a shelter setting. Our goal is to get them into permanent housing as often as possible. It may not happen 100% of the time, but that's certainly the goal. And we're also looking at crafting some of the additional funding that's coming down from federal sources to help meet that need.
So this is seen more as a halfway point until you can find permanent housing for these individuals.
Absolutely. Anybody who presents at our shelters, that's always our goal, and that's our goal in this setting as well.
I guess to clarify some confusion, so when you list those, requirements and it requires a doctor referral, so anyone could, if they are referred by their doctor, be placed in this. This is not just for homeless individuals.
Correct. This is not just for individuals experiencing homelessness. This could be for individuals who just need a safe place to isolate. A good example that has been provided is if they have an individual at home who's undergoing chemotherapy or is immunosuppressed, and that individual is not yet COVID positive, and they do not want to return home to them, that's an appropriate person to potentially be referred to this setting.
So then, is there a reason why you think the number is so low right now in terms of only having 6?
I think the great news from my perspective, and I'll let Monica also speak to this, is that our hospitals are able to manage the issues as they're facing them right now. So we aren't seeing exacerbated numbers within our hotel or our hospital settings. If that were the case, I think the number would be probably quite a bit higher in the hotels.
I just wanted to see, Kate, if you could talk a minute just about the restroom set up downtown at the library and the transit center. I realize you also had some involvement in that.
Sure. Yes, so in terms of the restroom facilities that have been set up in the downtown area, it came to light that this was potentially an issue. And so the Continuum asked our street outreach team that's housed at Phoenix Community Development Services to actually go out into the community, survey some of the individuals experiencing unsheltered homelessness to figure out what their needs are, and if their needs really had been exacerbated because of COVID-19. And they found that probably some of this issue existed before COVID-19, but it certainly is more of a challenge now as places that have facilities for restrooms and other items have been closed down. And so working with the city of Peoria on that placement process, we did identify the CityLink Transit Center downtown, as well as the downtown branch of the Peoria Public Library. Each of those sites have 2 restroom facilities as well as a sanitization station. So we're making sure that those are online and accessible to individuals who need them.
Have you gotten any feedback on those so far? Would people find those beneficial, thankful for having those available now? I mean, how long have they been there?
I can't speak to the exact number of days. It hasn't been a significant amount of time yet, so I haven't gotten direct feedback, but I'd be happy to provide that when I do.
Who's in charge of keeping those sanitized?
Sure. So the city of Peoria actually contracted with a vendor, and I believe it's kind of a turnkey contract with the portable restroom vendor to not only do the placement, but also to do the management of that facility.
And how long will those be around? Through the duration of the crisis, or indefinitely?
To the extent of my knowledge, how long those will be around likely is going to be associated with the end of the emergency declaration. Don't quote me on that, though.
Are there any additional questions?
At Generations in Peoria, there's like 2 facilities. Isn't there? Aren't they divided into like the memory care and is there 2 Generations in Peoria? It's considered 2 facilities, right?
I think there's one. So the question regarding Generation Peoria's facility makeup, and I think this speaks to a lot of long-term care facilities. They have usually one large campus and have maybe multiple buildings depending on the needs of their residents. Many of them have specific wings or designated buildings related to memory. Others towards just maybe more. Not outpatient is not the term I want to use, but more kind of individualized living.
Okay. And so the numbers that we're getting from them are for facility-wide, right? You're not dividing it up between memory care and another, independent living or that sort of thing.
Yes, the numbers on the Illinois Department of Public Health and related to long-term care facilities are for the full campus or the full organization. So it can include multiple buildings.
So going off of that, I know we've asked you a couple times this week, but I think, we're seeing the number grow in that facility. Right now we have 8 residents, 10 employees, another death, so unfortunately that you announced today. Do we know why we have not gotten one of these strike teams that the governor speaks about?
So the strike teams that the governor speaks about in terms of long-term care facilities, there's a lot of need for those throughout the communities. Right now, our long-term care facilities, as you point out, the numbers are growing and so forth. They are actually managing it really well. They're understanding their needs. They are getting staff tested. They're utilizing the Heartland Health Services. We've actually pushed that to all of our health long-term care facilities as a testing site, as well as they've provided us with information about how to get test sites for their patients and their clients. And so because they've been working through this process really well, we've been in coordination with the Illinois Department of Public Health. We've had on conference calls, but right now having a strike team isn't going to necessarily provide them with any additional support because they've actually been doing the due diligence that's been required. Really, the strike teams are going to be focused on entities that they see a large, quick growth, as well as maybe some issues about trying to understand the spread of the virus. In this case, we've actually seen staff that have been tested, they've properly been isolated, and we're seeing individuals recover through this. And again, those numbers are really, I want to be hesitant on those numbers as IDPH is pointing out, because as I mentioned, we wanted to be aggressive with long-term care facilities. So that includes even suspect cases. So imagine, again, that plethora of symptoms we talked about, the cough, the fever, but also the chills, the headaches. So we can have a resident or even a staff member that is saying, I have a headache and I have chills for 2 days. That would be considered a case in the IDPH definition as we work through this process. So I want to also just kind of caution about taking those numbers and kind of overlapping it into meaning the how fast that virus is moving through the agency. It's the fact that the Illinois Department of Public Health recognized the fact about the vulnerability and wanted to really take a very, very conservative definition of long-term care facilities. And so they're covering everything under the sun in that. So it's not just confirmed laboratory tests, it is also those suspect tests as well.
Are those suspect tests not, are the suspected residents, are they not being just automatically tested now that we have more testing?
So the question is, are we automatically testing individuals? Not necessarily. We are still treating everyone that comes up with those symptoms as a probable case or part of the case definition. And the reason why is, even though there is more testing, we also don't want to take individuals in a long-term care facility and bring them out into healthcare settings or into test sites where their exposure can change as well.
But you've mentioned that you guys are working on a plan to get people in there to do testing. I mean, it seems to me like the first people who should be tested are anybody who's showing some kind of symptoms.
So the plan is to bring testing to those sites, and not just individuals that have already experienced symptoms, but really focusing on the staffing as well as individuals without symptoms. Because what we are seeing is that they are so mild and a lot of individuals are asymptomatic that they're able to spread this virus. So really, I understand that wanting to know someone who is sick to know that they are COVID positive, but from a control measure, we want to capture those individuals that are showing very little to no symptoms and try to make sure that we understand what their status is.
So when you bring more testing into the homes, are you going to test everyone then? Is that the plan?
The goal right now is to bring testing in phases as much as we are able to get and then prioritize. For staff, we are recommending to go to those test sites that Heartland Health Services is providing 7 days a week. And then for residents, start focusing on those that cannot easily transport, and then then after that, the next year would be all the residents as well. But again, recognizing the fact that we don't want to move the healthcare, long-term care facility have been doing such a great job, and Chairman Rand really focused on that to take them out and to put them into other exposure points is a high-risk thing to do. And so again, we want to bring testing to them and prioritize testing to them and limit that exposure. We don't want to bring anything into an agency, especially one that hasn't had any cases, or again, recognizing that people can be asymptomatic. It hasn't really spread either.
But how will you prioritize it when you get in there and actually do testing on residents? You know, will you prioritize it and say, okay, we're going to start with these who have symptoms, and then we're going to test, everybody else, or what are you guys thinking on that?
I think right now the prioritization of long-term care facility testing kind of aligns with what the governor spoke of, which is looking at those that have had no positives, that have had no cases. Because once it's in a setting, we know it's in there. So they've already started that intensive process, and they've already started working with us locally. So it's really those that have not had any cases that we want to also prioritize. Recognizing again that the symptoms are so mild and that people can be asymptomatic that we want to control as fast as possible.
So I know you had mentioned there had been some type of process or conversations about training staff to administer those tests within the facility, so you would have to bring residents out. I know those conversations just started, but I mean, where's the progress on that? How quickly can we get staff in there to actually start administering tests?
So the idea of getting staff in there to test or bring them up to SPAR to test. So all the healthcare facilities, so Heartland Health Services, OSF St. Francis Medical Center, and UniPoint Health, as well as UI Comp, have all now designated staff to do the training education. They've created the curriculum. They've even found videos as well to kind of start prepping individuals. Really now is about getting supplies to those entities. And so we put out a request for over 1,000 test kits as our first request, and hopefully we can get some in here.
And use that with the state?
That is through the state lab, yes.
So the people from Unity Point and OSF and UI Comp, they're going to train staff members at the nursing home to do it. They're not going to go into the nursing home and do it. They're going to train staff members to do it.
Yes, the goal is to train existing staff in the nursing homes or help them familiarize them with the process. Again, a lot of our nursing homes do a fair bit of critical care already in there, and so a lot of it is just understanding the procedural aspects of it, and then letting them go ahead. And because they already have a process, they know their clients and their clients' needs better than the educators, and that way it's, again, limiting the risk of exposure in those areas.
So the decision on who to test is gonna be with the staffs with the nursing home?
It's going to be, I think, a recommendation, but I think that just going to be really focused on the long-term care facilities' understanding of their client base. I mean, we're going to rely on them. They are subject matter experts.
Monica, kind of going off of a bit what we touched on with Ms. Green, as she said, they only have, 6 people in this program right now, and, that's a good thing because it's meaning that our hospitals are able to kind of handle the number of cases we have right now. I know you gave the numbers earlier, but do you have, I know you've given it in the past, do you have that kind of percentage of what our hospital capacity is right now?
So I know the data in regards to ICU usage and related to COVID, but overall the EMS region, that Peoria region that we sit in, they're actually sitting about 22% of capacity. And so I think that is, that's a reason why we're not seeing the overutilization or the need to start having other entities start their housing plans as well.
Bouncing back to the assisted living facilities, we talked about how the numbers are increasing. Do we know how many have recovered?
No, I don't have that breakdown.
So I had an individual call and voice some concerns about cases in the Illinois Gastroenterology Institute, saying that, they had confirmed cases and they're being told you all have to come back to work on Monday or you'll lose your jobs. I guess from a public health perspective, kind of what role do you guys play in that? Do you play a role? If you could kind of speak on that.
So I can't necessarily speak to the HR discussions of different entities and how they're handling that, but we do give guidance to any entity that's had an outbreak or have even a singular case as an employer to explain to them the precautions, contact tracing. Again, not all contact is the same, and so we want to make sure they recognize that fact that you might have worked in a building with someone that tested positive, but depending on your interaction, you're at the same risk as if you were going to the grocery store filling up your gas. And so recognizing the various risk levels, as well as what type of service that agency provides. As healthcare providers, the CDC, the Centers for Disease Control and Prevention, and the Illinois Department of Public Health have different guidelines for healthcare workers in terms of masking whether or not they've been exposed. Recognizing that we can't take a group or a critical infrastructure and workforce out of play based on the fact of their risk associated with COVID. Our healthcare providers are dealing with COVID on a day-to-day basis. To take them out of plays, so they have a different set of regulations and follow-up. And so we provide guidance to all businesses, and so really I think that seems more of an HR question directed to that entity, but we've been in communication with many and to help them handle this kind of, especially as we're now going to go into May where there's more changes and more relaxation, what does it mean? And so we have been providing that guidance.
As we are going into tomorrow, face coverings are going to be required in a lot of places. If you could just go over how to properly wear face coverings, because I know there's been a lot of questions about how to properly put on a mask or a bandana or anything like that.
So the question is how to properly put on a mask or bandana in terms of face coverings. The key thing you want to recognize when you do a face covering is that the fit matters, and make sure it's covering your nose and your chin area. And as well as the sides. And so you really want to make sure that you are properly protecting that area, preventing airflow from coming in and out, trying to minimize all of that. And then depending on your need, you're going to have different variations of that face mask. Again, remember one thing about face coverings in general, that when you... Thank you. We can do a demonstration if we need to here. But one of the things you also have to recognize is that when you are able to keep social distancing available. Okay, so we have a general surgical mask here, which you'll see around. Okay. You're gonna, on some of these, you'll see that there's a wire on the top here. Some of them, I've noticed just looking around at the media here, some of you have built-in ones that kind of have a nose portion to it. When you put it on, you're gonna put it over your face like so. And you want to make sure you pinch it if there is a nose covering here, and you want to pull it down. Yes, you're doing a great job over there too. And you want to make sure you do that so that it covers it up as well as prevents it from the sides. And you want to make sure that's it. That's pretty much your basic areas. You want to make sure you cover all of that area. Okay? And then when you are done, you're going to take it off nicely, and you're going to put it somewhere. If you have a pocket or a bag, you want to keep it. A lot of people recommend putting it in paper bags for moisture reasons. If you have a cloth mask, you want to make sure you wash it and clean it routinely as well.
How long should you keep the cloth mask?
The cloth masks, you know,
Or
this,
the paper mask?
the paper mask, it really depends on, you know, like the type of usage you've used it for, really. And it's really about how much soiling of it happens to it. If you're walking and you're maintaining it, you can extend the life pretty long. But again, these are supposed to be disposable, especially these type. And so really, and we want to make sure we're saving certain types for certain groups of individuals that require it for critical infrastructure. So again, if you have a scarf, if you have a bandana, you can utilize that as well. And then again, maintaining social distance is always going to be appropriate, because when you are able to maintain full social distance, such as right now I am 6 feet away from all of you, I don't necessarily have to have a mask on right now, but I would still highly recommend it when you're out and about, because you never know when you kind of have to be closer together.
And is there a recommendation for how long people should keep the cloth mask?
For the cloth mask, again, it's going to be just material and then making sure that you're properly cleaning it.
And for people who don't already have masks and maybe don't know where to get one, would you have any advice on where they can maybe find some?
So for individuals in the general public that are looking for face masks specifically, again, use a scarf, use a sleeve of a shirt, can be broken up and use bandanas. But really, the Central Illinois Public Information Officers have pushed out great information about how to make your own, but also 211. They have a great resource as well. Great. Well, I will not see you guys tomorrow, so have a good weekend.